Hey, it's Brittany Watkins here, and I am sitting in my bed reading my emails, and I wanted to answer this question that we had through the support chat line about medication. So, Kathy writes, "Hi Brittany, there's an epidemic of obese psychiatric patients, and I am one of them. The older medications had a nasty side effect, like rolling your eyes in the back of your head, but the new medications make you fat. I've tried everything to lose weight, but I'm on 15 different prescriptions. Even if I glance at the refrigerator, I gain weight. Nobody's talking about medication-induced obesity, not Dr. Phil, not Dr. Oz, or anybody like that. I suffer from bipolar mood disorder, fibromyalgia, and arthritis in my feet. Can you help me? Sincerely, Kathy." So that's a really good question that I wanted to just take a few minutes to talk about here. I'm definitely not a doctor, and I do not give any medication advice, but I do know that issues like bipolar mood disorder and mood disorder medications do cause weight gain. And, the only thing that I'm going to say about that is that fibromyalgia and bipolar mood disorder and arthritis, those are all tappable issues. Sometimes with things like fibromyalgia, people, aren't really sure how to get to the core of that because, every time they have a pain, they're like, okay, well, I tap on this pain. But the pain, it's not really about the pain, it's about where the pain came from. So the pain is always going to be associated with an early childhood trauma. With anything like this, bipolar mood disorder, any kind of depression, pain like fibromyalgia is typically going to be connected to something earlier that happened to you, some sort of traumatic incident or maybe multiple traumatic incidences. So, of course, in, my work, that's one of the things that is the thing I focus on the most, is that we're always constantly looking for the early childhood traumas, clearing those and releasing them from the body so that the body can actually heal itself. The body is an amazing, amazing machine. And I find that when we take a lot of medications, we take away our intuition and all the magic that our body can create. So my advice to you, Kathy, would be to get off the medication. Talk to your doctor first, obviously, but ask him if you can slowly get off the medication and then start to do what I would do is I would make a list of traumatic events. This is not a fun exercise at all, but you can start to put the pieces of the puzzle together because you can start to see, I would go back to, what was happening right before you first discovered that you had this mood disorder. Did you have this your whole life? Were you born with it? Were you having this when you were 3 years old? Or did it start at a certain age? If it started at a certain age, rewind to about a year before that or any time before that. What were the major things that happened? Things to look for are sexual abuse, a negative relationship with your authority figure, people, especially tappers, we have a lot of traumatic things that happen to us. So I would start by making that list and then, find a really qualified practitioner that can help you tap through those things. And you're probably going to need to really get a lot of anger out as well. Anger is not something that I talk about in videos very often, but we work on it a lot in my Think in Advanced program especially. But I'm sensing with you that the fibromyalgia is more about stored anger than it is about really anything else. So I don't know what's caused that anger, but just go through your list and go through the things that have happened in your past that can cause that, when you think about it or when you write it down, when you look at it on a page, it makes you feel angry inside. And I would start there working through those things and tapping on the anger there. I hope you're a tapper. I'm sure you're probably a tapper. And if you aren't, then you can look up what tapping is and how to tap and all of those things. So anyway, I hope this is helpful. Thanks so much for your email. And, let us know if this is helpful and if you're able to overcome this. Okay, thanks. Bye.